Welcome to Angel Health Academy. Topic for the day or topic for the session is methods of patient care assignment or nursing care delivery models. Patient care assignment refers to the process of distributing the nursing tasks or nursing functions or nursing activities and responsibilities among healthcare providers or staff nurses, okay, or health personnel to ensure, the aim is to ensure that patients receive appropriate and timely care, okay, comprehensive patient-centered care that is appropriate according to his needs and problems and according to the or in the right time. So patient care assignment refers to the process. It is a series of steps to the process of distributing nursing tasks or nursing activities in the ward, nursing functions or nursing care of the patients and the responsibilities among healthcare providers, among the staff in that particular ward, okay, during the shift. So among the healthcare providers or nurses to ensure that all the patients receive appropriate and timely nursing care or nursing management. There are several methods are used to assign patient care, okay, in the ward. There are several methods, each with its own advantages and challenges or disadvantages. So each method has got its own advantages at the same time its own disadvantages or challenges. So it is nothing but assigning the patient care to all the staffs in the particular ward by the head nurse or the in charge. As I have already mentioned, patient care assignment is also known as nursing care delivery models. Nursing care delivery model, that is different models that is used to deliver the nursing care to the patients in the ward. Then this is also known as models of patient assignment. So it is a models. Thus it is known as models of patient assignment. Then it is also known as care modality, patient care modality. Okay, so patient care assignment also known as models of patient assignment, care modality, and very common, that is nursing care delivery models in the hospital or the ward. Now let us discuss about the some common methods of patient care assignment. We already discussed that there are several methods. In this video I am going to explain about the some of the common methods of patient care assignment in the ward or in the patient care unit. First method is case method or total patient care. Case method or total patient care. Second one is primary nursing. Third one is functional nursing. Fourth one is task-based assignment. Fifth one is team nursing. Sixth one is modular nursing. Seventh one is acuity-based assignments. Acuity-based assignments. Eighth one is workload-based assignment. Workload-based assignment. And ninth one is case management. And 10 is others. We have many others such methods of patient care assignment. Let us discuss these common methods of patient care assignment in this video in detail. First one is case method or total patient care method. Case method is also known as total patient care method, the complete care of the patient. In this model or method, a nurse is responsible for all aspects of care, all the type of care, okay, that is complete care of the patient for one or more patients during a specific shift. So you know that in the hospital we have a different shift system, okay, so either 3 shift or 2 shift like that, okay. In each shift staff get rotated. So here we are talking about only about a specific shift, one single nurse, okay, she is responsible for all the aspects of the complete or total care of the patient, either one patient, 1:1, or a few patients, that is more patients, okay, according to the number of staff available in that particular ward, that may be either one or a group, okay. Because of that it is called as case method or total patient care method. This is total or complete care of the patient that is handled by a single nurse, okay, that is only during her shift. That is very important. So a single nurse complete care in that particular shift, either morning or evening or in the night shift. It is a holistic approach because the nurse will give, a single nurse will give the complete care of the patient. That is comes under holistic approach. So case method is a holistic approach where the nurse handles everything, all the procedures. Okay, from administering medications to the basic care or personal care, like that each and every or the all the aspects of patient care or patient centered care is rendered by a single nurse or delivered by a single nurse. That is about the case method or total patient care method. So a single nurse, all the complete total care of the patient, either one patient or more patients, depends upon the situation, and only during the time of her shift, okay, will give care. So this particular assignment, the patient care assignment, is called as case method or total patient care method. Now let us see what are the advantages and disadvantages of case method or total patient care method. First one is there is consistency in care because a single person is rendering. Okay, so continuity is there and consistency is there. She has responsibility and accountability. So there is a consistency in patient care provided to the patient. So consistency in care is the first advantage. Second one is nurse-patient relationship, interpersonal relationship is very stronger because one-to-one approach. Okay, nurse-patient relationship or interpersonal relationship is very stronger in case method or total patient care method. So stronger nurse-patient relationship. Then third advantage is high level of responsibility and accountability because there is no other nurse to take care of the patient because only one nurse, she knows that. So her responsibility and accountability is very high. Okay, whatever happened to the patient, she is responsible and she is accountable. Okay, at the same time there are a few disadvantages of case method. First one is inefficient use of nursing resources. As you know that in the ward there are many nurses with a different knowledge and different skills and expertise. But we cannot use all the nurses in that particular patient care because we are assigning a single nurse to that particular patient or group of patients. That is the disadvantages of the case method, that is inefficient use of the available nursing resources or all the different type of nurses in the ward. Second one is higher cost due to less delegation of the task. So here the cost would be very high. If more patients is there means we need more nurses if we maintain 1:1 ratio. So the cost of the or expenditure for the hospital, it is very high. So higher cost due to the less delegation of the task because a nurse sometimes she is getting only single persons, not many persons. Okay, so if that or case method follows like that, the hospital may need or hospital authority may have to appoint more staffs or many staffs. So that is the disadvantages of the case method. Okay, this is about the case method or total patient care method. Now second method of patient care assignment is primary nursing. Primary nursing assigns one nurse as the primary caregiver, the important caregiver for a group of patients for 24 hours responsibility. So here see the difference between the case method. Case method we have same one single nurse only. Okay, primary nursing also one single nurse. But here she is the complete responsibility as it is a case method because she is the primary caregiver. Why it is called she is a primary caregiver? She is not only managing a single shift, okay, a particular shift. She manages the 24 hours of the day. Then at the end the complete hospitalization of that particular patient, okay, from admission to discharge. And here not a single patient, here is a group of patients. Okay, so primary nursing assigns a single nurse or one nurse as the primary caregiver for a group of patients, okay, for 24 hours responsibility, one single day, okay, or that particular day. Then it will be continued. Okay, the primary nurse oversees patient care. She supervises and she oversees all the patient care that is rendered by other nurses when they joined in the different shift. So she will hand over that particular patient to another nurse during the shift, okay, either in the morning or evening or in the night. But she is the ultimate responsible and accountable as she is the primary caregiver, okay. So she oversees patient care and she is responsible for the care plan. The care plan for the patient, particular patient, is made or prepared by the primary caregiver only, okay, or primary nurse only. Throughout the patient stay in the hospital is from admission to discharge, a group of patient is handled by a single nurse as a primary caregiver. Under that primary nurse, there would be supportive nurses or other nurses who comes in different shift, okay, but ultimate authority, responsibility, accountability is vested in only that primary nurse. So this is the difference between case method and primary nursing. So here also single nurse but a group of patients, but a responsibility not for only for the shift, the complete total stay of the patient in the hospital from admission to discharge, as she is a primary caregiver. She planned the total care of the patient with care plan, and that will be implemented by different nurses during their different shift under the supervision of the primary caregiver or primary nurse. Next is advantages of the primary nursing. First one is it is consistent, okay, the care is consistent or accurate, and it is a relationship centered care, okay, there is more relationship, so relationship centered care. Then there is a clear accountability and responsibility for the primary nurse. So clear accountability for the patient care. Third advantage is there is better communication, okay, more interpersonal relationship with the patient and their families, because a primary nurse deals with from the admission to discharge of a group of patients. So there would be better communication on IPR. Now let us see what are the challenges or disadvantages of the primary nursing. First one is high level of responsibility may cause the burnout. Sometimes primary nurse may have emotional burst, okay, because she has to accountable and responsible for the complete care of a group of patients. So though the shift change, different people may come and handle the patient or follow the patient care, but still she is the ultimate or primary nurse who is responsible and accountable. So because that may increase her responsibility, okay, that may cause high level of responsibility, and sometimes that responsibility may lead to some burnout. Burnout is nothing but getting emotionally disturbed and become anxious, okay. The second disadvantage is requires a high level of staffing, which can be costly. Like case method, here also hospital need a number of staff, okay, plenty of staff. That is a high level of staffing which can be costly, okay, and the staff must be more expertise to take complete care of the patient or give comprehensive and quality nursing care to the patient. So that all become costly, okay, for the hospital management or authority, and it may be difficult to maintain during staff shortage. So the third disadvantage is may be difficult to maintain during staff shortage. So whenever there is a staff shortage or shortage of staff in the ward or hospital, during that time it may be difficulty to assign the nurse as a primary nursing for a person or a group of patients. So these are the advantages and the disadvantages of the primary nursing. Now third method of patient care assignment is functional nursing. Okay, as the term indicate, it is something related to functions. Okay, so in functional nursing, the task, okay, that is nursing care or nursing care procedure, okay, or patient care are divided among the team. Okay, so in the ward, as I said, during each shift there are group of nurses, we call nursing team. So among the team, based on the roles, based on their roles, the staff is divided according to the task or according to the function. That means each nurse or healthcare provider or staff performs only a specific function or a specific task, okay, for all the patients who are admitted in that particular ward. So a nurse will render a single nursing procedure, okay, or nursing function that is called a specific task. But that is for all the patients in that particular ward. For example, one nurse gives medication to all the patients in the ward. Another nurse handles the wound care of or dressing of all the patients in the ward. Like that, another nurse take the vitals or check the vitals of all the patients in the ward. Like that, a single person will do only a single procedure for the total patients in the particular ward. That methods of patient assignment or patient care assignment is called functional nursing. Now let us see what are the advantages and the disadvantages of functional nursing. So first advantage is efficient in high demand settings. Okay, when there is demand is more or when there is high demand. Okay, for example, during staff shortage. Okay, we have a few staffs only. So in that case or in emergency situations, during emergencies, we can use this method as functional nursing. Okay, so efficient in high demand settings such as during staff shortage or in emergency. Okay, because already we said primary nursing cannot be done in the settings where there is a staff shortage. In such cases we can use a functional nursing, because a nurse will take care of all the patients, even though single procedure, that is to all the patients in the particular ward. Second advantage is task specialization allows for quick completion of duties, because this staff or nurse may be more expertise in that particular function or in that particular nursing procedure. So she can complete quickly, okay, because she has only one type of or only one function or nursing care. So task specialization or functional nursing allows for quick completion of the duties of the particular nurse. Okay. Then let us see what are the disadvantages of functional nursing. One is fragmented care. So there won't be any continuity because each nurse will come and they do only one care. Okay. That is called fragmented care, making it difficult for patient to establish a good rapport with the single nurse, because every time one single nurse will come, she finish her procedure and she go back, then she never comes. Okay, maybe she comes in the next shift, okay, to continue with the same care. Okay, so that is called it is a fragmented care. There won't be, or the patient may have difficulty to have a good communication, okay, to the particular nurse. Then less holistic care. As it is a single care, there is no holistic approach. Okay, so less holistic. When you talk about case method, I said it is a holistic method. A single nurse will give complete care, total care. So here less holistic care. Focus is on task rather than the patient needs. So they are not bothering about what is the patient different needs and problems. They come and they will finish only their nursing procedure. Thus it is less holistic care. Then third one is reduce the continuity of care, because each nurse bother only her specific function or task, not about the others. So that may lose the continuity of the care. Okay, that may reduce the continuity of the care. So these are the three disadvantages of the functional nursing. The fourth method is task-based assignment. It is somehow same as functional nursing, but there are a few differences. So task-based assignment. This method assigns nurses based on the task, based on the activities or function that need to be completed regardless of which patient the task is for. So they will be assigned to different task for the different patients. They have to complete that particular task. For example, one nurse might handle the intravenous fluid, okay, IVs, while another handle or assessment, patient assessment, like that. Here also a nurse will function in a specific task, okay. But what is the difference between the functional and task based assignment? It means in functional nursing, it assigns nurses to a specific task based on their expertise. Here in functional nursing, we selected a nurse according to her expertise, or those who have more skill will be given in that particular specific job. Okay, for example, medication, assessment, etc. Whereas in task-based assignment may not be necessarily consider the expertise. We won't bother about, or in this patient care assignment, the head nurse may not bother about the, or in charge may not bother about the whether that staff is having expertise in that particular or specific task, like that. But she focus purely on distributing the task among the available persons. So according to the number of staff, they will assign what are the different duties. Okay, what are the different patient care. Okay, then she will assign one nurse for in one task, because it is only task based. Okay, not bothering about the skill of or the expertise of the particular staff in that particular procedure. Okay, so that means the key difference is in functional nursing, the nurses are assigned to the specific function or task based on their expertise. Okay, based on their more skill in that area. Okay, but in task based assignment, that may not be necessarily considered, that may not consider the expertise, but that focus purely on the distributing the task among the available personnel or available staff in the ward to ensure the completion of the task. Okay, so there are many procedures. Our aim is to complete that particular procedure, that all procedures. For that we will assign the staff in a different procedure, not according to the expertise of the or skill of the particular staff. Okay, that is the difference between functional nursing and task based. Here only task based. In functional only, but that is according to the expertise. Their patient will get more quality and standard nursing care from the particular or skilled nurse or nurse expertise. Now let us see what are the advantages and disadvantages of the task-based patient assignment. So advantage is highly efficient when tasks are clear and simple. Sometimes the task will be very simple. Highly efficient services could be given when tasks are clear and simple. Otherwise, there will be difficulty. If the staff is not expertise in that particular procedure, she may have a difficulty. Okay. If it is simple procedure, it will be easy for her. That is highly efficient only when the tasks are clear and simple. Then second advantage is can be useful in specialized care settings. Usually, it is used in specialized care settings such as in surgical department or in emergency department, like that. Okay, because we have to complete the task. Our main aim is to complete the task. So it is useful in specialized care settings such as surgery, surgical ward or emergency ward for emergency care. The next is disadvantages of the task-based assignment. Patient may not receive the holistic care. Here also according to the task, okay, a nurse will come and she will complete her task and she will leave. So there is no holistic care or continuity of care to the patient. Then second one is thus it can lead to lack of continuity, and this is like functional nursing, it is also fragmented nursing or fragmented care. So these are the advantages and disadvantages of the task-based patient assignment. Now fifth type is or method is team nursing. As the term indicates, here and group of people, that's what we call it is a team nursing. So a team leader, usually a registered nurse, okay, assigns the task, okay, activities to a group of nursing staff. That includes RN, that is registered nurse, okay, then LPN or LVN, that is nothing but licensed vocational nurse and licensed practical nurse. Like that, a category of nurses are available in the foreign and abroad. Okay, and nursing aides, nursing assistants. Okay, all this become a team. Okay, because of that, it is called a team nursing. So a team leader, usually a registered nurse, assign the task of patient care or functions to a group of nursing staff. The group include a charge nurse. So there will be a leader. Okay. Usually she will be a registered nurse. So a charge nurse or in charge, then number of registered nurses according to the number of staff in that particular ward. Registered nurses to do the senior nursing procedures. Then we have licensed vocational nurse or licensed practical nurses. Then we have been assistant with nursing aides, okay, or nursing assistants. So these all charge nurse, that is team leader, registered nurses, then other supportive nurses like LVN and LPN, then nursing assistants, that is nursing aides, all comes in a group under team nursing. Okay, a team leader is responsible for the complete care or coordinating the patient care. So here leader will coordinate and she make all the subordinates or other staffs to render the patient care under her leadership and under her coordination and supervision. That is called team nursing. Now let us see the advantages and disadvantages of the team nursing. So advantage is promotes collaboration among the healthcare team, because as it is a team, there is a good cooperation and collaboration and coordination among the staff members. So it promotes the coordination and collaboration in rendering nursing services to the patient. Second advantage is efficient use of resources. So there are many nurses with the different skills. All the nurses are utilized in the team nursing. So efficient use of resources. Okay. Tasks are delegated according to the skill level. Like functional nursing, here also task is delegating the particular team member according to their expertise in that area or according to their skill level. So there will be efficient use of the resources of total number of staffs in rendering the patient care. Third one is flexibility in staffing based on the patient needs. So here the care will be given according to the patient needs. So that means with the limited number of staff, we can complete the care of the group of patients. That care will be only based on the needs of the patient. So if the number of team members less also, they have a good cooperation and coordination and collaboration to render the patient care. That comes under flexibility in staffing. Now let us see what are the disadvantages of the team nursing. First one is it is time consuming, because there should be a leader. Leader should plan, she should direct, she should make periodical supervision, periodical discussion, and she has to insist the staff member to prepare the care plan, that has to be checked, etc., etc., like that. So here the team leader has to coordinate, she has to evaluate, or she has to supervise for all the team members. So planning the team and delegating the responsibility and evaluating the responsibility, everything will be time consuming. So the first disadvantage is time consuming. Second one is require strong leadership and communication skill. If the leader is not strong or not having good leadership quality or communication skill, then there won't be efficient or consistent or continuity of care or quality or comprehensive care to the group of patients. Thus, it requires strong leadership and communication skill from the part of the leader, okay, team leader. Then it may lead to fragmented care if coordination is poor. If there is no coordination in the team nursing, then the care will become fragmented, not holistic, okay. Then continuity of the care can be compromised, okay, because actually it is done by not a single person, it is done by different members of the team, but that cannot consider as a continuity of care because it is not done by a single person. So these are the 4 disadvantages of the team nursing, okay. Now sixth method of patient care assignment is modular nursing. Modular nursing. Modular nursing is a modification of team nursing. Just now we discussed what is team nursing, and modular nursing is nothing but it is a modification or it is a variety of the team nursing method only, where the patient care area is divided into modules, okay. So module means a small area, okay, fragments. So divided into modules based on the geographic location of the patient, where the patient is stay in the hospital ward. That is based on the geographic location of the patient. Here I have mentioned an illustration. You can see that this is a ward, okay. The shape of the ward is C shape. Now you can see that here we have one vertical wing, okay, 2 horizontal wing, like that. So in each wing we'll make one small team, okay, that is team nursing. So each wing is considered as a module. So module 1, module 2 and module 3. So there will be in that one particular ward there would be 3 modular nursing plan, okay, that is module 1, module 2 and module 3. So that is called modular nursing. So it is a modification of team nursing, okay. Here the patient area is divided into modules based on the geographic locations. So it will make easier to render the services, okay. Thus each module has a small team of caregivers or staff nurses who are responsible for all patients within that area or within that module, okay. Thus it is a combination of functional nursing and team nursing with limited nursing staff, okay. So here also we apply the functional nursing only in each team members. So modular nursing is a combination of both functional nursing and team nursing with limited nursing staffs. Okay, so with limited or small number of or small team of staff nurses, we render the services as a functional nursing. As you know that a group of patient, a single nurse will have a specific functions, okay, according to her expertise and according to her skill. So that is about the modular nursing. It is a modification of the team nursing and it is a combination of both the functional nursing and the team nursing. Now let us see what are the advantages. It facilitates the better communication and collaboration because there is a small team members. So they cooperate, they coordinate. So there are better communication and collaboration among the team members. Then it promotes better use of nursing resources. In the small team also we use all the nursing personnel. So better use of available nursing resources or staff. Then third advantage is it allows for individualized care within the each module. So though there is a module, in each module the person, small team members will function as a functional nurse or functional nursing. Thus it allows the individualized care within the or in each module of the modular method. Now let us see about the disadvantages of the modular nursing. First one is it may not be suitable for a large or complex patient population. If there is a large population and complex patients means patient is need more serious or complicated patient care or nursing care. Okay, in such area, in such condition, it is not possible. So may not be suitable for a large or complex patient population in the particular ward. Then team effectiveness depends upon the, as we have already mentioned in the team nursing, that is depends upon the leadership skill. Okay, the skill of the leader. Here also there is a leader and a number of team members or staff nurses. So effectiveness of the modular nursing is based on the leadership quality or skill of the nurse in charge or the leader. This is about the modular nursing. Now, seventh one is Acuity-Based Assignment. Acuity-Based Assignment. This method considers the complexity and intensity of patient needs. That is called acuity. Okay, when nursing care assignments or during the methods of patient care assignment. So, as the term indicates, it is acuity-based, based on the need of the particular patient or based on the problem of the patient. So this method considers the complexity and intensity of the patient needs. Okay, so sometimes patient will be complicated patient, so they need complicated nursing care. Sometimes patient may need only simple nursing care, but here we give importance of the intensity of the patient problems or patient needs and complexity of the patient needs. So according that we select or we assign, that is called acuity-based assignment. That means patient with more complex care needs or required complicated care, senior nursing procedures are assigned to the nurses with the appropriate skills, okay, and time availability based on their time availability of that expertise. Okay, so patient with more complex care needs will get senior persons with the appropriate skill and expertise. Okay, and according to their time. Okay, it will be assigned according their time availability. Okay, that comes under acuity-based assignment based on the complexity and the intensity of the need of the patient. Okay, now let us see what are the advantages. It ensures patients with higher needs receive the appropriate attention with a nurse who have skilled in providing the higher needs or higher or complicated or intensive nursing care. Second one is it is more equitable distribution of workload among the nurses. So it is equitable distribution according to the expertise or skill of the staff. Okay, so it is more equitable distribution of the workload among the staff based on their skills and expertise. Now let us see the disadvantages of this method. So first one is it requires accurate acuity measurement tools. With this tool only we can measure the acuity of the patient needs. Okay, so it requires accurate acuity measurement tools. Second disadvantage is can be challenging to implement if patient needs fluctuate frequently. So patient first may need intensive care. Okay, later he may need a simple care. So that will be fluctuate. Patient problem and needs will be fluctuate. In such cases it will be challenging because If the patient need simple nursing care, we will assign that nurse maybe a junior nurse. Okay, she can handle that particular situation. Suddenly, patient may go for or he may fluctuate his needs into intensive care need. Okay, that means it will be challenging. We have to change, or that may be challenging for the particular nurse to render the nursing care or needed nursing care or comprehensive and quality standard nursing care to the patient. Thus, it can be challenging to implement if the patient needs fluctuate or patient problems fluctuate, okay, frequently from simple to complex. Okay, so this is about acuity-based assignment. Next is workload-based assignment. Workload-based assignment. Patients are assigned to healthcare providers based on their acuity level. Acuity level, now you know that according to their needs, okay, from simple to complex needs. With more complex or high needed patients being assigned to more experienced or more skilled providers or more skilled expertise nurses. So now this is almost same as what we have discussed about the acuity patient assignment, but there are some difference. Okay, that is the different here. It is not based on the acuity, it is based on the workload of the staff in the ward. That's what it is said, workload based assignment. This is usually determined by a nurse manager or supervisor based on the patient needs and provider capabilities. So of course here there will be a nurse manager or a supervisor to see that whether the patient is getting the accurate or consistent care or need based care. So what is the key difference between the acuity based assignment and workload based assignment means acuity based assignment focus mainly on patient needs and conditions, that only we call as acuity, and it ensures that most critical patient get the attention of the most qualified nurses. That will be selected, that will be given according to that. Okay, whereas in workload based assignment focusing mainly on the total workload of the nurse or the caregiver, not about the acuity of the particular patient. Here we are focusing the total workload of that nurse or caregiver, which includes not only patient acuity but also the time and effort required to perform a various tasks for each patient and ensure a fair distribution of the care task. Now there are group of nurses in the ward, so their task must be equal to all the people. So here we are going to balance the task of all the staff nurses. Okay, because some care, though it is a complicated, though it is a intensive, that needs less time only. But some basic care needs more time. For example, giving a sponge bath requires a minimum 15 to 20 minutes. So that extend. So workload of that particular staff will be more. Work hour will be more. Okay. So here we are going to balance that workload or the hours of work. Okay. That means in workload based assignments, which includes not only patient acuity but also the time and effort required to perform a various tasks for each patient, and that ensure a fair distribution of care task and time for each nurses to reduce the nurse burnout and workload balance. So here we are just balancing the workload of the each staff nurse in the particular ward. Otherwise sometimes they may be burnout, emotional burst. So here such feeling, emotional feeling is considered, and the patient care assignment has been done according to the workload based of the particular staff nurse or the staff nurse of that particular ward. So these are the difference between or key difference between acuity based assignment and workload based assignment. Now let us see what are the advantages of workload based assignment. First one is it ensures that more experienced staff handle more complex cases. Okay, potentially improving patient outcomes. That automatically helps to improve the outcome of the patient because more experienced staff handle more complex cases. Okay. Now let us see what are the disadvantages or challenges. It can create inequity, okay, in workload. So it can create inequity, okay, inequity in workload of the different staff. Or it can create inequities in workload if it is not well planned. Okay, inequities in the workload. or it may lead to provider or nurse burnout if not balanced properly. So the in charge has to see to balance the workload of that particular ward or staff nurse of the particular ward. Otherwise, there will be inequity in the workload of the different staff, and there is a chance of burnout of the particular staff when they have more longer or more workload than the other staffs. So this is about workload-based assignment. The ninth one is case management. Another patient care method of assignment is case management. A case manager, often he may be registered nurse with MSc nursing qualification, is assigned to coordinate the care for a patient with complex healthcare needs. So a patient is admitted with complex or complicated healthcare needs in emergency settings and may need intensive care. Okay, for that we assign a particular person, a staff, is known as a case manager. He manages the complete responsibility of that particular case. Okay, and the person may be registered nurse with MSc nursing. Okay, more qualified than the other BSc nursing. Thus, the case manager ensures that the patient receives appropriate services according to his complex healthcare needs and follow up on treatment, and at the same time he manage from the admission to discharge about the transition of the patient from different departments transfer. Sometimes patient may be shifted from one area to other area. During that period also it is managed by the case manager. So case manager is having complete responsibility and accountability of the total care of the patient with the complex healthcare needs. Okay. Now let us see what are the advantages of case management. It is useful for patient with a chronic condition. Okay, for prolonged period if they are in the ward, they might be need a case manager. Okay, so it is useful for the patients with the chronic conditions or complex care need patients, or when a patient is having multiple healthcare providers. So multiple healthcare providers means many healthcare providers in the field of nursing and the paramedical healthcare providers comes in multiple healthcare providers. In such a case, patient care has to be coordinated by someone. For that reason, we will appoint a case manager. Then let us see what is the disadvantages. So the disadvantage or challenge is it may be resource intensive. Okay, we need more resources. Okay, like we need a MSc person for the to act as a case manager. Okay, because we need to well organize the patient care. And we need a skilled communication because patient is treated with multiple healthcare providers. So that is the disadvantage of the case management method. Okay. Now 10th one is others. There are some other methods or other models of nursing care delivery. Nursing care delivery models. First is patient rounding method. Second one is rotational assignment method. Third one is Triage-Based Assignment, and last one is patient-centered care assignment. So others includes the patient rounding method, rotational assignment, triage-based assignment, and patient-centered care. First one is patient rounding. Okay, here healthcare teams performs regular rounds, nursing rounds, to assess and discuss the status of each patient. So here there is a team. The team will make regular rounds, periodical or routine rounds of that particular patient. During the rounds, they assess and discuss the patient health condition, patient health problems, treatment aspect, nursing care aspect, etc. Then based on the regular rounds, the assignment of care providers may shift based on the patient needs. So though the care provider may shift according to the need, but the rounding model, this model involves a direct involvement with the care team. So during the rounds, every or all the team members together will come and assess the patient. Okay, so they have a active involvement in the patient care, or they have a direct involvement in the patient care. So that is about the patient rounding method. Okay, so healthcare teams perform regular rounds. During the rounds, they assess and discuss the health status of the each patient, and based on that, the care providers may shift, but all the team members have or involved in the direct involvement in the patient care with the healthcare team members. Next one is rotational assignment method. Rotational assignment. As the name indicates, here there will be rotation of the staff. So the providers or the nurses rotate through different types of patient care units or roles on a schedule basis. As per the schedule what they have given, they follow the services. Okay, that make a rotation. So for example, a nurse may rotate between the intensive care, general medical ward, surgical units every few weeks. That means according to the duty schedule, okay, or duty roster, a nurse may rotate from one ward to other ward, from one specific unit to other unit. That is given, for example, between the, sometimes she may be in the, or 1 week she may be in the intensive care unit, or 1 or 2 weeks as per the rotation. Then she may shift to next, that is the medical ward, or then she may go for the surgical unit. Like that, every week as per the rotation, as per the schedule basis, she may have a rotation in patient care. So that comes under rotational assignment method. Then third one is triage-based assignment. Triage-based assignment. Here assignment is based on the triage. Patients are initially assessed according to the triage system. Okay, based on the severity of their condition, patient will be classified as triage. But later, then assigned the specific healthcare provider based on their needs. So now changing that. That is, first will be assigned based on the triage, which category the person is coming. Okay, then assigned to a specific healthcare provider based on the needs of the patient. Like that, based on the triage, then later based on the need. This is often used in emergency department or urgent care settings. Okay, and so in urgent care settings or emergency department, we use a triage-based assignment. Last one is patient-centered care. Patient-centered care method. This model focuses on the patient needs and preferences. So till now we have talked about the patient needs. Now it is taking patient preference. According to the need of the patient, patient also may have some preference. Okay, his likes. Okay, preference as the central element in care planning and delivery of nursing care services. So here we give patient-centered care. Based on the need and preference of the patient, we plan the nursing care. This care is typically delivered by a multidisciplinary team, okay, where each healthcare provider work within their scope of practice, often with a strong focus on patient and family involvement. Here they make an involvement of patient and family in their decision making of their healthcare services or nursing care services. So involvement of patient, involvement of family, and according to the needs and likes or preference of the patient, a group of team members, nursing care team members with a multidisciplinary team means nursing teams, paramedical staff, etc. Okay, different departmental staff together. So far we have discussed about the common methods of patient care assignment. That includes important 10 methods. So we discussed about case method of total patient care, primary nursing care, functional nursing, task-based assignment, team nursing, modular nursing, acuity-based assignment, workload-based assignment, case management, and others. Others we have discussed about the patient rounding method, rotational assignment, triage-based assignment, and patient-centered care. So today we have discussed in detail about the different patient care assignment methods or models of nursing care delivery. Okay, actually it is a requested video. Hope this video really benefits in your studies and exams. So if you feel it is really worth and beneficial, please like, share and subscribe my channel, and stay tuned with the Angel Health Academy for the next and important academic video. And please don't forget to convey your gratitude in the comment box. And once again, thank you for watching my video. See you and take care.